I just want to let you know as a disclaimer that this is for educational purpose only, and whatever is happening here, we do our best within the given limits and framework to answer your questions, but we are not your medical providers or your doctors, so you should please speak with your provider before you implement anything. The ones who don't know me, my name is Pratiksha Gandhi. I'm an MD from India and I have done my major work in India. I had multiple centers, up to 15, helped more than 100,000 people in preventive cardiology. I eat, walk, live, breathe just for one purpose, that how can I keep people away from hospitals and surgeries? That has been the work of my life. And I'm here to share with you that how we help people to prevent blood pressure if you don't have one, or if you have blood pressure, how can you control it in a holistic way and prevent the complications. And with me is my good friend Dr. Mark Kalina, who is our medical director. uh, as a disclaimer, you cannot sue me because I am not licensed in US. I didn't take, because I believe in reducing medications, whereas US wants to keep on. It's a pharma driven industry. So I'm helping people from outside, but we have the man who is inside the system and trying to fight with the system and make it better. And that is Dr. Mark Kalina, who has more than 30 years of experience as an holistic and internal medicine. And he was a primary care at Scripps and now at Pullman. And Mark, would you like to say something?
No, no. I know I very much believe in lowering blood pressure, keeping blood pressure, and it is a craziness. So I think it's is a good conversation because it's not well done quickly and briefly in the office, and a lot of people have thoughts and fears about it. And I like to alleviate fears. And Pratik has a lot of knowledge, and then I'll add my pieces. So I
Okay.
hope you enjoy it.
Thank you, Mark. But before we begin, I just want to let you know who we are. So, we are basically a preventative wellness clinic, which are based in Encinitas, North County, but we work online all over US, like how we have our friend Cindy, who is also a Good Heart ambassador, who is from Ohio and visits us and does online. Our aim is to prevent and reverse heart disease, hypertension, cholesterol, diabetes in a pain-free, drug-free manner, and we are adjunct to standard care. So why we host this monthly events? Because we want to educate the community about alternative holistic healthcare options. Okay, so we like to basically do a lot of root cause analysis and then develop individual plans. So that's what we do. Now let's dive straight into the topic. Okay, so when we talk of blood pressure, we there are two numbers, right? The top one and the bottom one. The top one is what we call the systolic blood pressure, and it is like 120, but now the new guidelines is 115 as normal, and the bottom one is like 80 and the new guidelines is 75. So generally we say, oh, my blood pressure is like 120 80 or 110 70. So the top one is when the heart is squeezing, heart is like a pump. So that is a top pressure, and the bottom one is when the heart is relaxing, and both tells us certain things. Okay, and especially when your bottom one, that is your diastolic pressure, is higher, like 90 100 that is not a good sign. That directly suggests that your heart is really under heavy pressure. And why it matters, of course, because we know that stroke and heart attack are the major causes of deaths and disability. And heart disease, hypertension is basically silent, but it has got a lot of complication on your eyes, your kidneys, your heart, and different body parts. Okay, so we need to control that. So, what is the plan today is we are going to look into the different causes of blood pressure. And as I'm talking with you, if anything comes up in your mind, please write in your notes or drop it in your chat, because there is a lot to uncover over here. Then We are going to talk about certain labs which people never get offered. Our idea is, as I told you, that please talk to your providers. These are just the general recommendations. It may or may not apply to you, but as I told you, that this is an educational event just for information. Then, what are the evidence based natural support which we can do? We also want to give you like a daily routine which you can start immediately. What is happening under the blood pressure, okay? So when we are looking at blood pressure, it's like just like, okay, there's a reading, but then there is some important thing which the standard care never looks at, and now actually it is coming in a big way in a prevention, is the cardio metabolic health, okay? So what is cardio metabolic health, where we are looking into like your weight, and especially weight around your belly. So there is something known as a waist hip ratio. So you measure around your waist, your and then around your hips, and in centimeter or inches, and that ratio should be less than 0.85. If it is higher, then you are under cardiometabolic strain, okay? Then you can also, that there is something known as, you may not have sugar, but there is something known as insulin resistance, which can again be seen in the lab work. So there are a lot of things which you can be seeing. There is rigidity in the arteries which is setting in, okay? There is calcification which is going on. So there are a lot of things. There is inflammation activity which is going in. Then many times there are nutritional gaps which are there. There may be like low sodium, low potassium, magnesium. Okay, so there are sometimes drug interactions going on, or many times lifestyle things. I think all of us have the snacking habits, right? And in US, majority of the snacks, to make it addictive, has too much of salt and sugar and all those things. And people don't talk much about sleep, but I would say that sleep is the foundation. And many times, like, people are having like 8 hours sleep, but they don't have what we call deep sleep, which is a restorative sleep, or there is another type of sleep which is REM sleep. So if anybody is tracking through variables, through Apple Watch or Aura Ring and all, can get all these numbers. Okay. So guys, just to let you know that there are a lot of things happening in making of a pressure, okay? So this is like the snapshot of all the root causes. So when we see people in our clinic, we just don't look at blood pressure as a number, okay? We just go through all these things. And then we also look at the nitric oxide levels. And we have always seen a correlation that low nitric oxide levels actually is very much there in high blood pressure or uncontrolled blood pressure. And there is another thing which is like chronic stress, like there is a lot of cortisol which is secreted. And we are say that there's a typically a word like wired, uh like you're constantly wired, and there is like always jumping from task to task, what medically we call sympathetic overdrive. So these are the things which are actually not discussed in a standard care visit, and this is what we would like to bring up the discussion afterwards when we are talking, that what is it in you which is actually, if you have blood pressure, just as you see the slides, please see that, check on your sleep. What are the medications? Are you taking some excessive alcohol or something? Is anyone is into tobacco intake? What is your salt intake? Generally up to 6 grams, that is 6,000 milligrams. But sometimes, like if you have a bag of chips, that itself is so much, right? So what is in it in you which could be causing? Okay, so please, as you are listening to me, just deep dive into your own health, because this whole idea of this talk today is to transform you and make you better than when you entered in this meeting. Okay, so basically, let's go that many times what we have seen is that what happens in a typical standard care visit, okay? Every time you go, the blood pressure is taken. And many times just the pill is kept on adding. But if you really want to look, these are the additional labs which we can see. What are the other things which are happening in your cardiovascular system? So there is something known as cardio IQ and an extended lipid panel which can be done beyond your normal cholesterol, because here everyone is, majority are in this group today are above 50, and average age of getting a heart attack in US is around 65 years. Okay, so one thing which standard care misses is that I always like people tell me that, oh, I got a heart attack, it was so sudden, but then when I go into the case taking, oh, I have blood pressure for 20 years, or I have this cholesterol, I was taking a statin. Okay, so the point is that when we are having blood pressure, it is also good to look into the other risk factors and metabolism which can affect the heart. Okay, so these are the other tests which are generally not done in standard care, but many times if you have a genetic history of heart problem, or like parents have got heart issues, or you have got high blood pressure which is long standing, it is good to ask for this test, especially when your blood cholesterol is normal, because almost 70% people have normal blood cholesterol levels till they get a heart attack. So that is the reason it is good to ask for this test, because like as you see, ApoB, basically it gives us idea about if those there are blockage making factors in your arteries. Then cardio IQ is an extended lipid panel, which gives us lot of data on the different types of cholesterol. Then LPA, which is lipoprotein A, HSCRP, which is basically a inflammatory marker. So many people have like cholesterol which is normal, but they have got inflammation. And many times inflamed arteries are rigid arteries and also giving blood pressure. Then homocysteine levels, which are there, many times if they are higher, they can also give rise to blood pressure. And many times, if you have high homocysteine levels, there is something known as MTHFR gene testing, which we have seen a correlation that many people who have this genetic mutation have higher blood pressure. So you can go into lot of diving deep in getting the root causes, and when we identify these causes and start correcting them, we have seen a lot of improvement. And as I was talking about insulin resistance and pre-diabetic, HB1AC and C-peptide, these are all the things which can be done. So I'm not here, I know it's too much to consume, but what I'm just showing and opening a door that you have a lot of options beyond standard care actually to go and look into the root causes. Okay, so let's go next. So now let's come to the solutions. Okay, uh, mindfulness and stress reduction. I feel that is the most important thing which we talk about for reducing your blood pressure. And there are a lot of techniques which are there. There is breath work, there is non-sleep deep relaxation. So there are a lot of things which can be done, which I will be talking when we are doing the discussion. But I want you to write that, start adopting mindfulness and stress reduction techniques. Second thing is that even aged garlic extract is good for both. It is good for lowering cholesterol, lowering blood pressure, and it has got a lot of therapeutic benefits. Then coenzyme Q10 is extremely good for your heart health and has also been naturally helping in lowering blood pressure. Beet juice is extremely good, which is there. And then there are certain studies which have shown the flax seeds is also good. Like, when you take flax seeds, 2 or 3 spoons, grind them, and if you want to put them in your salads or some smoothie, they are also good. So as I told you that the natural your lifestyle basically is very very important. How you sleep, how you move, that is your exercise, how you eat, and weight loss and weight control. So these are the important things which we have to dive into. And many times I have seen that just when you lose like literally 10 pounds, there is so much of drop in blood pressure, so many times if someone is overweight, actually losing blood pressure is, I mean, if you want to lower blood pressure, losing weight is the fastest thing. Okay. Then we always talk about, I think, a power morning routine. Like generally we get up in the morning, we always want to get on the phone and look at the messages or look at the news. I think the worst way to start the morning is to look into the news, because that's the surest way to increase your blood pressure. Because everything is so negative, and actually the news are actually designed to activate your brain in a very negative manner to increase your heart rate and blood pressure. Okay. So my if you ask me, whenever I do my talks, I always say that please start your day with some breathing and some meditation or some calming thing. Or even like if you have access to sun, even just looking at the sunlight early morning, especially when the sun is rising, it's very important because it releases cortisol and makes you awake, and it also helps you in setting up your circadian rhythm. So just, and that is what actually was practiced in ancient India also, that like people used to look at the sun in the morning. So there is a science behind it, and if you like, there is Dr. Andrew Huberman, who is a professor from Stanford University, runs podcast. You can listen to his podcast. That how to improve your sleep and circadian rhythm, and in this he mentions about looking at the sun. So start your morning with a very good power morning routine. Then have good colorful plants, we call the rainbow colors, high fiber diet, and again I'm making it clear, low sodium and high potassium, but the sodium should not be so less also that you get into low sodium into your blood levels, which is doing your serum like metabolic panel. Generally, the when you do your visits, they do a metabolic panel where they do your electrolytes. So please ensure that your sodium is not like less than 139. It is good to keep it at 140 or 142. And in the evening, what you have to do is also like have a good phone time, like after, like before bedtime, like 1 or 2 hours. Just stop your phone, emails, TV, and all those things, and wind down. You can again do some breathing, relaxation, and all that stuff. So these are very important things. And I'm going to talk more about how to take the blood pressure because I don't want to put it in the slides, but we're going to discuss about how to take the blood pressure and what are the do's and the don'ts when you're taking blood pressure at home, because there are a lot of mistakes which are done. And then, as I told you, that low nitric oxide is one of the causes for high blood pressure. So nitrate rich foods are very good add-ons, and especially green leafy vegetables are, and beets, they are good nitrate sources. Especially there is what is organic Tuscany kale, is a very rich nutrient dense food. Organic Tuscany kale. Okay. So these are the some of the things which you can start doing. And if you feel that you feel like a whack-a-mole, that you're like in this system where okay, people are just like targeting on getting the cholesterol down or the blood pressure down, but nobody is going to the root cause, then please show some reactions over here. More pills and the life is same, like because this is the kind of community which we are supporting, who are proactive, who want to go to the root cause, lower their medications, find some alternative to drugs like statins, and high blood pressure medication dose. So we just want to work on people who really want to work on themselves, because when you work on themselves, then only we can get our medicine down, otherwise the medicine will have to do the work. So I want to little bit take a break here and share this. I just said, let me know if you hear the sound. You can hear the sound, Niva?
Yes, I can.
Okay.
Hi, my name is Dr. Kim Kelly, and I would like to give a testimonial on how the ECP treatment benefited my blood pressure. I was diagnosed with high blood pressure, believe it or not, at age 12, which the doctor, of course, thought was very unusual for someone so young. And he just believed it was, due to my upbringing in Seoul, Korea, where I grew up in the first 6 years in an orphanage. But anyway, he did not want to put me on medications, which I'm very grateful. And he just wanted to monitor. And then once I graduated from college, though, my blood pressure was actually even a little higher. And that's where my primary doctor put me on Vasotac. And then a few years later, they switched me to lisinopril to manage my blood pressure. And that was fine. And then once I became a student of naturopathic medicine at Bastyr University, that's when I learned about this herb called carditone. So I put myself on that and got off the medication. And that managed my blood pressure somewhat, even though it was still about 135 over 85 to 90. And then last year, I bumped into Dr. Pratiksha Gandhi, and she told me about this new treatment to help with high blood pressure. So I said, please sign me up. And she told me it was 35 treatments. And I said, of course, I'll do it. And anything just to help my blood pressure that I've had for my whole life. And it was about treatment number 20 is when I noticed, my blood pressure seems to be lowering. So I cut my carditone in half or started taking every other day. And then eventually after my 35th treatment, I stopped completely. And my blood pressure remained stable, or very low. And a medication without any herbs or supplements. And I know it's because of the ECP treatment. And another note is I have this, it's called the WHOOP band, which measures heart rate variability, which is another predictor for lifespan, health span. And also I used it to help me, determine if I should have a hard workout. But back when I started wearing this in 2020, all the way up to last year, my average HRV was actually kind of low for someone, my age. It was usually in the high 20s. That was my average HRV. But after the ECP treatment, and this is more I noticed after the final treatment, it's now gone up to the 30s, and now even in the 40s is my average HRV, heart rate variability. So that was another nice benefit, and it still is stable at that higher number compared to what it was before I started the ECP treatments. So I highly recommend anyone who wants to try it because one, it's relaxing. You have an hour on the table, and I just use it as a way to meditate and zone out. And then the other benefit was it helped my blood pressure and my HRV.
All right. So, what we also offer at our clinic is external counterpulsation therapy. So, this is for heart health. And this is basically has been a game changer for many people who especially want to reduce medication, reverse blood pressure, and do it in a very safe, non-invasive way. So this is not something which we recommend for everyone. We do a case selection, but this is something which we are sharing as a lot of people have been benefited for this. And this is a less known therapy, though actually it is there in major, more than 1,000 hospitals in US, including the Mayo Clinics and Cedars-Sinai and all those big institutions. But it is used for heart patients after surgery fails. And I've been pioneering this therapy for more than 25 years. And we have introduced this in North County. So a little bit, as you see, like you lie down like this for an hour. We tie the cuffs on the calves, thighs, and the butts, and the session is for an hour. And what actually we are doing is like you see this side and this side. This is what happens in 35 hours. We are opening up all the collateral circulation. And when, like, how, like, Dr. Kelly is actually a naturopathic doctor. So, what exactly happened? Why did the blood pressure lower? Because when we are doing this 1 hour thing daily, it increased all the nitric oxide levels in the heart. There is a secretion of VGEF2, which is vascular endothelial growth factor, and there was a reduction in the burden on the heart. So it basically does a lot of things on your heart. And if anybody is interested, we can share a lot of studies because ECP has got more than actually 400 studies, and there are more than 30 studies just on how it helps in lowering the systolic and diastolic blood pressure. So anybody who is actually struggling with a very resistant kind of a blood pressure, which is like not responding to medications or having too many medications and not getting relief, this could be one possible option. So what does the research say? What we are doing is we are increasing nitric oxide through these sessions, and the root cause of the blood pressure is arterial stiffness, which is, in simple words, hardening of the arteries. So it actually reduces the arterial stiffness, and that is how we have seen so many people getting benefited. And along with that, it also helps in lowering inflammation, cholesterol, and a lot of things we do at our clinic, which goes to the root cause, not only the ECP, but other lifestyle things also what we do, the breath work, yoga, attitude training, mind training. So we are like kind of having what we call a multi-pronged approach, towards reversing blood pressure. So now what we do is we stop here so that we can have some question and answers. Our goal is that we want to help you as much as we can within the given limits. So I first go with Dr. Mark, and Dr. Mark, you want to add something to this? I think many of
Yeah,
you.
I think blood pressure is very naturally controllable. I think the biggest things, as Pratiksha mentioned, is what the emotional factors and being emotionally reactive. Classically, in the world, that's been studied as anger and depression and angst, being scared, which are a big part of life that we don't talk about uh, a lot of times. But I think the emotional factors, and I just read a really good article this weekend in the New Yorker magazine. So it's not a medical magazine, but they had an article about perfectionism. And that actually is that 60 to 70% of people actually have that. And it's more so in kids. It's becoming a more and more of a competitive, intense world, and everybody feels this need to be perfect. And I don't know the exact solution, but actually they do talk about it, and it really is just a mind shift to away from what the world necessarily values and into something where you just value yourself and care about yourself and that you believe that you matter. And I just think we live in a very intense, judgmental, polarized world, and bringing peace and calmness to yourself and to other people and to your family, that's what actually changes lives in primary care more than anything else. And I know the food things matter and all those things, exercise, but I think when people feel safe inside, that's what really helps them more than anything else.
Yes, I think that's so important that when we talk about the attitude training and the mindfulness training, that is what is exactly the idea, that we have to strike the roots, right? Because we are living in this world where there is so much of stress and people getting mad at each other and anger and all. And that is where attitude training helps a lot. So, any other questions you have, if anybody wants to ask?
You can unmute yourself and just go for it. Yeah.
How do you measure nitrous oxide?
So you can, that's a great question. So nitric oxide strips are available on Amazon. They just cost some 15, like $10. You get a strips, and it is just a salivary test, and you can see actually you will get whether it is low, medium, and all. We generally keep it at our clinics, and we measure that, but you can do it at home also. Second thing is, I would like to tell you about the blood pressure measurement and what is white coat hypertension. I think some of you must have seen that when you typically go to a medical facility, suddenly your blood pressure is high, but when you measure at home, it is not that high. Any one of you out here? I know one person for sure, right? So this is actually really a medical term, which is white coat hypertension, which is, and almost 25% of the people have this, okay? Because when they, that's like the anxiety of seeing a provider or something like that. So most important thing is that if you have a medical appointment, you please reach like at least whatever your appointment time before. Don't be rushed, or many times it's not your fault. You go in and immediately you will have a medical assistant, come, I have to take your blood pressure and all that, and you are not even given time to rest and something. So you have to be like rested. So you have to be calm. That's very important. You don't have to keep your legs crossed. Many times, many of us have this habit of crossing our legs and all those things. Your feet should be parallel, okay, and not crossed. Your wherever, if they are taking lying down, great, because then the blood pressure cuff and the machine is at the same level. But the 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 machine has to be the same level of your arms, okay, because many times there is, sometimes we see they are kept up behind. So how they are taking the blood pressure is also important. And as I think we are speaking with Rebecca also told in the week, the size of the cuff is also important, right? If there is a huge person and then the cuff size is small, then things can go wrong. So if you are taking your blood pressure at home, I would recommend that please calibrate it with your healthcare provider. What do I mean? That healthcare providers, they have the manual one, and sometimes especially the electronic ones nowadays, they are having blood pressure on the higher side. Okay, many times it is 5-10 points higher side. So calibration is that your blood pressure reading and the provider's blood pressure reading are more or less matching. See, point two to five difference is okay, but not like a massive difference of 10 or 20 or 30. Because whenever we see anything which is high, don't panic. First, see all these things, that were you relaxed? Were you, because blood pressure, remember, is a variable. Okay? When, if you are going to be excited, agitated, or rushed, your blood pressure definitely comes on a little higher side. I don't know if anyone has undergone a treadmill test. When we are doing a treadmill test, we are actually monitoring your blood pressure when you're walking and you're running and all those things, and we see that how your blood pressure is going up and going down and all those things, okay? So does this make sense? You can show me some reactions if everything is okay, and if you guys are understanding it right. Okay, good. Does this make sense? So please be intentional. Second thing, uh, also when you're taking blood pressure, uh, try to see that whether if you're doing in the morning, and when you're making your notes, please write the medications. That's very important, because I see most of the times that people are just keeping on changing medications. What is written on the prescription, sometimes they are taking half of it or one, they just keep on randomly doing it. But I would say that please be transparent, that whatever medications you have taken, because the provider needs to understand the correlation, okay? So with what medication, what is the response, okay? And because one of the things which we help in our practice is, and that's the reason we are cash pay and private practice, because the problem in the conventional standard care insurance system is, if you want, like, you can actually research and see online that here the doctors are incentivized to keep you on medication. That is how the healthcare system is in America. Okay, they are incentivized to keep people for prescription adherence. So in a, because many people ask us that why are you private pay or cash pay? But the reason is because if we do insurance, then I actually cannot even have a conversation with you of reducing the medications or reversing your disease, because the insurance, whenever we have that visit recorded under insurance, it is always like we have to write the notes, and based on those notes we get paid by the insurance in an insurance based clinic. So the conversation has always has to be, okay, this is your medication, this is your dose, you please take it on time, you take it for 3 months and see me again. If your blood pressure is under control, good. If not, then I'll add another medication, right? That's what it goes. So now, dear friends, you're understanding that why we are keeping on adding pills and not getting lower, because it is I'm sorry, but I feel compassionate for the doctors who are in the system. That's how it rolls, you know. Now, and that is where me and Mark have started this movement, that if you believe that you want to take primary responsibility of your health, then you will have to stand up and speak for yourself, you know, and take action. Otherwise, you will always be given measure blood pressure and keep on taking pills. Okay. All right. Any other question?
I think Julie had a question about does blood pressure increase as we age in the chat.
Yes, you're right, Julie. So what happens is that if you see, one of the causes of blood pressure is arterial stiffness. Okay. So what is happening, that as we are aging, our arteries become harder, stiff, and calcified. Okay. And so when the normal blood pressure is 120/80, but after like 65, 70 years, we allow up to 140/90, 150/90. So every 10 years, we allow that normal, okay, 150/90, 160/90. So we allow that because we are giving you age related accommodation in the blood pressure. Okay. But still, it cannot be like, okay, if you're aging, then we can allow 180, 110 and all. Anything which goes diastolic, especially. Now, another thing which I just thought of and which is missed in standard care is they don't do echocardiograms to see that how your blood pressure has affected your heart. That conversation never happens. You know why we have so much of heart failure in America, and there is something known as diastolic dysfunction heart failure. That is because of so many years of blood pressure, your heart muscles have become so thick that they are not able to relax properly, and then your lower blood pressure, your diastolic blood pressure, always remains high. So keep in mind that your diastolic, that is your lower blood pressure, should be around 80 or 90. But if it is remaining at 100 or 110, that's not a good sign. Okay. If something like that is happening, you definitely need to see someone, your provider, work on medications, and work intensively. Second is that if you like, and that is what we have a offer here. If you guys are interested, especially the ones who are living in San Diego and can come to our clinic, we have an offer here where we do a 2D echocardiogram, where we study the effects, that whether the blood pressure has affected the muscles of your heart, and how is your anatomy, what is your structure of your heart which is going inside. Typically, in an insurance based model, any kind of screening test is only done when you have a symptom like a chest pain or a breathlessness. They don't do all this test. But we are proactive and we want to help people before anything major thing strikes. So we do all these things.
Dr. Gandhi, Rebecca has a question up next for you.
Yes, Rebecca, what is the question?
Is there a way of calibrating a machine from home? Because currently what I'm doing is I have there's an Excel template for blood pressure, and
Okay.
I'll put on there, and it was done in the doctor's office. And then I'll put my numbers, or if the fire department did it, I will put in the comment section fire department or anything significant happening that day. But
Yeah.
they're always way off.
So calibration, Rebecca, is basically what we are talking, that your blood pressure, like suppose a fire, whatever the other person is coming in, and he's recording the blood pressure and what number he's getting. At the same time, you do with your machine also and see whether those numbers are matching. You know, the idea is that whether your machine is accurate. Make sense?
Yeah, I've done that in the doctor's office.
Okay,
I've
great.
taken my machine in and they'll
Yeah.
do it, and the nurse will stand right there and I'll do it on the machine, and it's just way off.
Your machine is way off, you mean to say?
Mm-hmm.
Then change the machine, you know.
Well,
gets.
but I don't think you know, frankly, if it's the doctors or your machine or what, because in
Right.
my opinion, they're all unreliable. And there's so many variances depending on how your arm is and how you're sitting and whether you had coffee and whether your legs are crossed. And there's 100 different variables, but the machines themselves, in my opinion, ignorant and unprofessional opinion that it is, the machines are unreliable. And I've got two machines that I use at home all the time, and they're, I would say 80% of the time, they come back with significantly different numbers. So I'm really kind of at sea on trying to gauge this. I'm not seeing any numbers that are extraordinary, like a systolic above 150. I almost never see, and a lot of the numbers on the top number hover around 125 to 145. And even though I find those unreliable, I think they have sufficient relevance that I'm not in danger. But the bottom line is, I don't even know if there exists a reliable machine. Well, and that includes,
Right.
and
So
that
Nick,
includes,
let me answer. I got your point. So you're partially correct that yes, there is a lot of variations and this, but see, look, we are clinically in practice, we are seeing this, right? So the best way is taking average of 3. Okay, so whenever, like, suppose you are taking, like, because when we also see, like, when we are sitting in the clinic, because we are doing calibrations all the time with a lot of people's devices. So when you, with the same device, you take pressure at 3 different times, if the blood pressure on an average comes in a range, okay, so, and blood pressure is a variable. You are right that if you have taken a coffee, but still there is, like, there is a pattern which is over there. And that's the reason we tell you to take readings, because you have to see your pattern. Like, what is your trend which is going on? Make sense? So you have to see the trend, and you have to be within the normal range in that trend. Like, for example, even blood sugar. The blood sugar, anyone I don't know has done a CGM, which is a continuous glucose monitoring, right? Your blood sugar can go from 60 to 140 to 190 or all those things. It is variable, but still there is a trend. And what I'm asking is that what is your trend? Does this make sense, guys?
Yes, because I go through that with the CGM all the time.
Exactly.
But my blood pressure machine at home, I'm using it as, okay, I don't have this high spike. I'm staying kind of.
Monique's up next for questions, Dr.
Yeah.
Gandhi.
Hi. So I'm actually asking the question for my mom, Susan.
Okay.
Can you develop side effects to a medication after you've been on it for a year or more?
Yeah, you can develop, as long the side effects could be at any point of time.
So you can be on a medication, it'll be fine, and then
Yeah, after some time also you can get. It depends on, many times it is on duration and on the dose and all those things.
do you think you have a minute to talk about some of the common side effects of blood pressure medication, or is that out of the scope of this conversation?
Yeah, we have just kept that out of the scope because, like, it's quite a lot. It cannot be done in a minute, to be honest. Yeah, so that's why what we are going to do is that we are putting in our intake forms. If anyone is interested, can fill in the intake form and submit it to our clinic. We will review that, and we can just give you a summary if you have any burning questions, because we want to be specific. Okay. And if you're interested in a consultation, then that would be a next step. So Niva has just put in the intake form. So that will be the best way to go, because there are so many medications and there are so many side effects, honestly. And it will just go on and on. So we can talk relevant things to relevant people who are taking certain things.
What about low blood pressure? I'm on amlodipine, 2.5 milligrams a day, and my blood pressure is low 100s over in the 50s or low 60s pretty much daily. Is there a concern there at all?
Yeah, it just seems like it's too good a control. I mean, if you're truly that low, it sounds like maybe you lost weight or you did something to get healthy and you don't need the medicine anymore. That's
Well,
what I'd
no.
say.
Well, no, I've been plant-based for 4 years, and I am quite active, exercise. I recently were diagnosed with severe heart disease, 70% blockage. But I'm just concerned if the blood pressure is that low, is that okay for?
Yeah, it's
I think
okay if it's over 100. I think it's systolic. I think you're okay. But, each person, it needs to be individualized. And are you having symptoms like when you stand up? Because a lot of times if people's blood pressure is low and they stand up quickly, they get lightheaded because it actually drops to 90 then or something like that. So it's a whole clinical decision. And if you got to have a relationship with your doctor if they want to, if they want your blood pressure that low, and then that sounds like that really is the dream. But again, it's different in each person and needs to be
Okay.
discussed
you're
with
taking, so basically what we can do is that if you're okay to put the intake form, because yeah, as I told you that you can get out of amlodipine also. There
Well,
is
yeah,
a
I
way
was
of
thinking
it.
about skipping, taking it and
Yeah,
skipping
but it will
every
have
other
to be
day.
done under supervision. That's what. So we can have a separate offline conversation on that.
Because
I'll
I would
more
eventually like
than
to get off of it, period. As long as my blood
exactly.
pressure
There you go.
maintains, yeah, I want to get off the damn thing. Yeah.
Exactly. Great. I'm happy for
Danny, I
you.
love your spirit.
Lab.
We're
There
so
you go,
happy for you,
man.
man.
Thank
Good.
you.
Yes. Thank you, Danny.
Okay.
Yes. So I hope because we have just last 1 minute, and I hope you all really enjoyed. It's truly being a great pleasure having you all. Just to let you know, some housekeeping. We have another fantastic event coming up on 21st of August. Oh, thank you for those hearts. Thank you.
Oh, you guys are the best. Seriously, thank you so
So
much.
so 21st August, we are having a happy heart hour with our chief cardiologist, Dr. Brian Asbill. So you will get another email, and we are so grateful that you're a part of our community. And please feel free to stay connected with us. My apologies if something has not come off clearly to you. Nick, we take your feedback on slides seriously. We will do better next time.
And make
And
sure it's font 50, like
and
you do
and
in your
and
book.
and Nick, if you want to have a conversation with me, happy to talk to you. You can tell Neva I can talk to you. Our goal is basically that you live longer, happier, healthier. You know,
Well,
and we stay
I'm,
away.
I'm,
Yes, Nick.
I'm a very experienced person, and I would definitely have that conversation with you, and we could essentially trade your knowledge for some of mine, which I would share with you, including tips on public speaking. So
Okay.
I think I can help you as well.
Thank you so much, Nick. I appreciate. Yeah. And Cindy, you have asked this question on Cardio Miracle. So we can, so Cardio Miracle, I will just see because I have to see the contents of it. There are thousands and thousands of supplements in the market. So we don't know. So happy to, you can just send me that email and then we can look into what are the contents and then we can talk about it. Okay. So thank you very much. Have a great evening and we will see you soon. Bye bye. High five.